Today we're going to discuss how to work on some shoulder health, rehab, prehab for pitchers, but all throwers in general. So it's commonly known that pitchers can hurt their shoulder, injure their shoulder, rotator cuff, whatever it may be, during the throwing motion, especially during the release phase and the follow-through phase. So you have a ton of eccentric loading and requirement of strength in the eccentric component in the external rotators of the shoulder whenever you're getting to that end range. So basically the arm is just trying to decelerate to offset then the acceleration and the velocity as the arm comes through. So if you want to train, it would be a good idea then to train in an eccentric manner for that part of the rotator cuff. And one way to work on that is to grab a band looped around the foot. You'll do it on your back, which I'll demonstrate here in a second, but just for video purposes. So you would bring the leg up, rotate back. As you push down, you allow that eccentric phase, 2, 3, 4, 5 seconds, whatever you want. Back up and down, just working on that eccentric portion, that eccentric loading of the infraspinatus teres minor, your external rotators. So when you lay it on your back, ideally for the athlete, it would look like this. Bring it up, and then you can repeat. With that, the one thing to watch is whenever you're getting near the end range of your internal rotation, the athlete may actually just protract their shoulder to get more motion. So at that point, you would stop once they end their internal rotation. From there, all they can do is protract, so stop at that point and then reset and come back up. One thing you can do, since pitching is not just in the sagittal plane, it's also in the frontal plane, so when you're throwing, you have some of that horizontal adduction. You could just put the band on the opposite foot, and you'll add a little bit more of a diagonal component similar to a PNF pattern. But again, it'll be an eccentric focus. So you'll be up, lower, and then coming back through with a little bit of horizontal adduction. Again, up, back through. So those are two pretty nice ways that are easy and simple to strengthen the rotator cuff in an eccentric manner to hopefully help with prevention of injury or rehab of injury for any pitcher or thrower who's looking to get back to playing again.